We're well into the fourth wave of the pandemic, unfortunately, and we do have 89 cases as we speak at the moment, total since the fourth wave began, 32 active cases. Those numbers obviously fluctuate on a day-to-day basis, but it still is a very high level of risk of transmission, within the community. We did develop a new way of guiding the community through this fourth wave, and we have the green, yellow, and red level alerts in which we implemented in a way to just bring awareness to the level of risk in the community. Green being obviously a more of a lower risk of transmission of the virus, yellow being a moderate risk, and red being a higher risk of transmission of the virus. And that's going to be based upon many factors, but cases being one of a number of cases in the community being one, number of people in isolation and such will also play a role in there. And obviously in the overall situation in and around the community will also be looked at. So right now we are in what's, we need to be a high level or a red level alert. And will remain there on as long as we feel it's appropriate. In the past, we had the green, yellow, orange, red, and each one corresponded with different levels of measures or directives or closures and such. That old chart, disregard that chart. That no longer exists because the goal moving forward is to we're still trying to get a path back to the new normal. So when we have this new alert system, it's basically communications to the community about where we're at, raising the awareness once again, and about mask, distance, hygiene, and so on, as we've been talking about forever and ever. It's so that people are at least aware and become more vigilant in certain times throughout the pandemic. Over the next weeks and months, we may go from green to back to yellow, back to red. We may stay in the red. I mean, only time will tell where we're going to be. But that's not tied, again, directly to any specific directives and stuff moving forward. Every piece of the puzzle, works together. But again, the level of alert, is for community members just to become more vigilant, more aware, and a reminder that we are still in the midst of a pandemic and we still have to take this very seriously. It rolled out very smoothly. Obviously nothing's perfect. There are, like every process they roll out, there are a couple of incidents that people are not in agreement or such, but overall, it did roll out smoothly, and we'll continue to deal with those one-on-one as required. But I do believe that most people who are impacted by it, they understand the bigger picture. We understand it may cause some difficulties at times, but again, we want to keep businesses open. And if this is one step to keep businesses open, I think it's in everybody's best interest. Like I said many times, but the goal more and more is to try our best to continue to relieve those measures, but at this point, we have to put a pause on stuff because of the fourth wave and kids going back to school and such. But at the same time, more and more of the responsibility is now lying with these various institutions and such. Like for example, education decisions made for the students and education, how that works. The end of the day, the decision is made by education system. Same thing for KSCS and hospital and other places. So it's not all centralized with the former task force. It's up for each entity, including MCK, to make decisions, for themselves. And will this provide the guidance from a public health perspective, and if need be, a directive for public health specifically on how certain things should apply in terms of, say, mask and distance and stuff of that nature. But that's the path we're on. We're going to try our best to stay on that path because we understand everybody's tired of hearing pandemic, and believe me, the people behind the scenes working on this are very tired and sick of it as well. When we want to see a path through, and we have to take some measures to get us to the end, we might have to do that for a little while longer.